uh, entitled Comparative Study of Artificial Intelligence Detection Technologies from Exception, Ischemic Shock Require Medical Help Imaging, author Sada and me, and Amadou Gueye. Uh, Without further ado, we will move to the presentation. In introduction, stroke is a global health problem, with ischemic stroke being a major cause of death and disability in men. The symptoms of an ischemic stroke occur suddenly and are most severe within minutes. Indeed, most ischemic stroke occur suddenly, develop rapidly, and result in the death of brain tissue within minutes or hours. As an example, in Senegal, our concept, there are hospital facilities where we can and do attend in the event that the radiologist is not present at night or in underserved areas, or that the radiologist is not a specialist or a no neuroradiologist. Rapid clinical diagnosis and imaging are essential to minimize the morbidity and mortality associated with ischemic stroke. However, rapid diagnostic imaging and clinical management of ischemic stroke remain imperative for optimal patient selection. Given the need to make complex decisions that optimally require analysis of large amount of data for better patient interpretation in limited time, the application of artificial intelligence should help to further accelerate and optimize the clinical management of stroke. In our paper, we have made a comparative review on the medical imaging techniques used in the diagnosis of ischemic stroke, and we have shown by making a literature review that in general can help to identify abnormalities that clinician and lighten a workload that they were doing manually, and that it's possible to have it automatically and quickly, but it's very important. In literature review, medical imaging techniques use it in strokes. Medical imaging technique make it possible to obtain 3D image of uncorrelated precision, their non-invasive nature, allowing to look inside the body without opening the body surgically, justifies a great interest in both clinical and fundamental research in the study of various normal or pathological functions of the brain. The techniques discussed in this paper are computed tomography, radiography, magnetic resonance imaging, MRI, and immediate CT reliable distinguishes between hemorrhagic and ischemic stroke, and detected sign of ischemia as early as 3 hours after stroke onset. No contrast. NCCT is the standard imaging modality for detecting ischemic stroke. NCCT is faster, more expensive, and less expensive than MRI, and 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 it's more used in Senegal, generally in Africa, because it's it is less expensive. However, NCCT may not identify change caused by hyperacute ischemic stroke. NCCT does not provide information to the extent and severity of hypoperfusion. Because of the difference of NCCT, new method of CT stroke imaging are being investigated. This method include CT angiography, CTA, and perfusion CT. They can provide information about patency or vascular occlusion, location of occlusion, and length of occluded segment. MRI particularly important in acute stroke patient with abnormal symptom. Although MRI is more expensive and less commonly used, it may be a better method of early detection for treatment of stroke patient. One limitation of MRI that it take longer than necessary because we have to obtain the result or in rapidly, because MRI can detect all type of stroke. Some physicians believe that MRI should be the imaging modality of choice. The author of four had in their tongue and all had in their study the sensitivity of MRI for the diagnosis of any type of acute stroke was 83%, and that of CT scan was 26%. MRI may also be a better method than CT for determining which stroke patient may benefit from TPR administration, and after a 3 hours windows. And technique used for evaluation include diffusion, weighted imaging, perfusion, weighted MRI. Early detection of ischemic in related work of ischemic infection is important to classify patients as potential candidates for thrombolysis because of the narrow windows of therapeutic effect. It's also important. And several studies have used a machine learning algorithm to identify ischemic infection on CT or MRI. Tang et al. Develop a computer-based automatic detection protocol using an adaptive circular region of interest head scan without contrast to detect subtle change. And another study showed that artificial neural network was able to detect an acute stroke MRI within 4.5 hours of stroke onset, with an average sensitivity of 80% of mimicking a stroke, with a specificity of 86.2%, and it's the high level. In relative work also, this study we can cite core infarct volume segmentation, use image protocol like NCCT MRI, and establishing of Basling in eye model on DWA using automatic lesion segmentation, differentiate white matter hyperintensities caused by chronic small vessel disease seen in CNN, able to distinguish acute from sham stroke within 4.5 hours. And the study large vessel occlusion used image protocol, NCCT, CTA, CTP, MRA classification model like LVO or not LVO, and the neural network combining various demographic, imaging demographic to predict LVO, large vessel occlusion, and the VIS algorithm on set detect proximal LVO. The aspect gradient, NCCT, CT, TDM, WE, automatic aspect score calculate, and the commercial software was compared and found to give better results per rapport to neurologists for the evaluation of ischemic shock. However, E-aspect did not perform as well as neuroradiologists when scoring aspect in acute stroke patient with an abnormal appearance that had an abnormal baseline. E-aspect improve sensitivity to early ischemic shock on acute CT scan. And in conclusion, medical image processing improve patient care. In fact, implementing diagnosis software in the early hours of a brain blockage can help to detect early signs of ischemia. Here we see that artificial intelligence provide highly accurate and precise technology solution for stroke diagnosis, severity, and prediction of functional outcome. Current application of artificial intelligence in this field offer tremendous opportunities to improve treatment selection and clinical outcome. and by assisting in all stage of diagnosis and treatment, including detection, the triage, and outcome prediction. In future research on eye technology are needed for wider use in different real work settings. The need to dispense with a contrast media, the importance of building application model to serve this message area or place where there is no possible of doing MRI at any time, or that MRI is expensive for some patients. To have first aids before can be a possibility, and as the implementation and of an algorithm model to highlight stock at the same time to that of different MRI in the reference.